Hello everyone, welcome back to MMS Max Medicine Simple. So our today's topic is endocrine functions of one very important gland. What is that gland, sir? That is our adrenal gland, right? Our suprarenal gland. So with this important note, now see here, this adrenal gland has two components. One is adrenal cortex and the second one is adrenal medulla. This adrenal cortex comprises the 78% of gland. The 78% of adrenal gland is adrenal cortex and the remaining 22% of the gland is adrenal medulla. Now see here, very important. This adrenal medulla produces certain substances known as catecholamines. What are these catecholamines, sir? So the most important, the major catecholamine produced by the adrenal medulla is epinephrine, 90%. 90% of the catecholamines produced by adrenal medulla is epinephrine. The second one is norepinephrine and the last one is dopamine. So adrenal medulla comprises 22% of the adrenal gland, produces catecholamines. The most important 90% of these catecholamines is epinephrine, then norepinephrine and dopamine. Now see sir, adrenal cortex. So this adrenal cortex has three layers. How to memorize? See here, GFR, right? So the first G is zona glomerulosa. The first layer of adrenal cortex is zona glomerulosa. This is the source of one mineralocorticoid known as aldosterone. The first layer of adrenal cortex is zona glomerulosa. This is the source of one mineralocorticoid, aldosterone. Now see, the second layer is F, zona fasciculata. This is the source of one glucocorticoid known as cortisol. Now sir, the last is R, zona reticularis. This is the source of sex steroids known as DHEA, dihydroepiandrosterone, also androstenedione. So adrenal cortex has three layers. The mnemonic is GFR. First layer is zona glomerulosa, produces mineralocorticoid aldosterone. The second layer is zona fasciculata, produces glucocorticoid cortisol, and the last one is zona reticularis, produces sex steroids DHEA and androstenedione. Now sir, very important. Out of these three layers, which layer has the stem cells to form new cortical cells? The answer is zona glomerulosa. Zona glomerulosa act as a stem cell to form new cortical cells. Now, very important. Out of these three cells, which cell form the major population of adrenal cortex? The answer is zona fasciculata. 50% of area of adrenal cortex is formed by the zona fasciculata cells. So with this important note, so now we will see all three group of hormones one by one. So the first one is aldosterone, also known as mineralocorticoid. Why mineralocorticoid, sir? Because of some specific actions. So what are those actions? So this aldosterone perform four vital functions. What are those four vital functions, sir? So see here, this aldosterone regulate the resorption of sodium, and we know wherever sodium goes, followed by H2O, water. So this aldosterone regulate the resorption of sodium and water. Now the second, sir, this aldosterone also regulate the excretion of very important ion, potassium. Not only this, sir, also H plus ion, acids. So the four vital functions of aldosterone are resorption of sodium and water and excretion of potassium and H plus ion, acid. So these are the vital ions of our body. That's why, right? That's why this aldosterone hormone, also known as life saving hormone. What is the major life-saving hormone of body? Is aldosterone. Very important. Now see sir, where this aldosterone will act in nephron. So the site of action of aldosterone is collecting duct cells, right? So we have two major cells. One is P cell, the principal cell, and the second one is I cell, intercalated cells. So in the nephron, it will act on the collecting duct, and there are two cells, P cells and I cells, where this aldosterone will perform its action. So what are the functions performed by these P cells and I cells? So see here, this principal cell P cell perform 3 out of the 4 vital functions. What are those functions, sir? It regulates the sodium and water resorption and potassium excretion. And the remaining one function is performed by the intercalated I cells, that is H plus ion excretion, acid excretion. Now sir, very important, see here, this is one typical principal cell. We know the basolateral end and the apical end. Here is our aldosterone. Now, very important, this aldosterone will enter inside the principal cell, right? So we know that aldosterone is one steroid hormone. So steroid hormones can easily enter inside the cell. Now, inside the principal cell, where this aldosterone will go first. So first, this aldosterone will go inside the cytoplasm. Why in cytoplasm, sir? Because in cytoplasm there is something called M receptor, MR receptor. The mineralocorticoid receptors are present inside the cytoplasm. So this aldosterone will go inside the cytoplasm first and will bind to MR receptors. Now this will form something called hormone receptor complex. Very important. Now what, sir? Now this hormone receptor complex will go inside the nucleus, right? And here the aldosterone will upregulate something called sodium channels and will cause resorption of sodium. See here, now the sodium is coming inside, and we know that wherever sodium goes, always followed by water. So sodium and water resorption. Now, what are these sodium channels, sir? So these are ENaC, our favorite ENaC channels, known as epithelial sodium channel. Now, in certain conditions, these ENaC sodium channels becomes overactive. So the function is sodium resorption. So there will be more and more sodium resorption. Now what, sir? That's why there is increase in blood pressure and patient will develop hypertension. So because of the overactivation of ENaC, the epithelial sodium channels, there will be more and more water and sodium resorption. That's why there will be increase in the BP and the patient will develop hypertension. And this syndrome is very popular, very important. The name is Liddle syndrome, right? Now, this aldosterone inside the nucleus also upregulates some potassium channels and will cause excretion of the vital ion potassium. What are these potassium channels, sir? These are our ROMK, the renal outer medullary potassium channels. So now we know by upregulating the ENaC channels, this aldosterone will cause resorption of sodium and water, and by upregulating the potassium channel, the ROMK, this will help in excretion of potassium. Now with this important note, so this is just to summarize what we have discussed in our previous slide. So here is ENaC, epithelial sodium channel, where this aldosterone acts and increase the sodium resorption. This one is our ROMK, the renal outer medullary potassium channel, for the excretion of our vital ion potassium. Now see the clinical correlation. We know that whenever this ENaC is overactive, right, the patient develops hypertension, and this syndrome is known as Liddle syndrome. For this purpose, we use something called ENaC blocker. These are the diuretics. The name is amiloride, right? So with this important note, so till the time we have seen that out of the 4 vital functions of aldosterone, three vital functions are performed by principal cells. What are those functions, sir? Those functions are resorption of sodium in water and excretion of potassium. Now very important, the fourth remaining function is excretion of H plus ions, excretion of acids. So for this function we have intercalated cell. See here, sir, very important. This one is the basolateral end. This one is the apical end. So for this function, this intercalated cell have one very important protein channel on the apical end. What is the function of this protein channel, sir? So in the presence of aldosterone, this protein channel throw these H plus ions outside into the urine. In response, these potassium ions comes inside. So this protein channel throw the H plus ions, the acids outside into the urine, and potassium channels in response comes inside. So there is exchange of ions. So what is the name of this channel, sir? So the name of this channel is H plus K exchanger, hydrogen potassium exchanger. Very important to note, sir. This channel is, this hydrogen potassium exchanger is exclusively under the influence of aldosterone only. Now very important, on the other end, the basolateral end, this intercalated cell have one more protein channel. What is the function of this protein channel, sir? So this protein channel move the bicarbonate into the blood. In response, one chloride ion comes inside. So again there is exchange of ions. So what is the name of this channel, sir? This is bicarbonate chloride exchanger. Very important to note, sir. So this type of upregulation of protein channels takes place only in certain situations, in certain conditions like acidosis. Very important to note, sir. That's why these intercalated cells are also known as type A intercalated cell. Why, sir? Because here A stands for acidosis, and this type of upregulation takes place only in acidosis. So the main function of intercalated cells are H plus excretion. Very important to note. So with this important note, so now we will talk about the regulation of aldosterone. What are the factors which regulate the aldosterone secretions? So see here, very important. The first one is very important. The most potent stimulus, the most potent factor which regulate the aldosterone secretion is hyperkalemia, elevated levels of potassium, right? So hyperkalemia is the most potent stimulus, most potent factor which regulate the release of aldosterone. Now the second most is hyponatremia, the third one is hypotension, and the fourth one, very important, is RAS system, activation of RAS system over renin, angiotensin, aldosterone system. So these are the four factors which regulate the aldosterone secretions. Very important. Now see pharmacology. The T half of aldosterone is 20 minutes. So with this important note, so after aldosterone, the next hormone we are going to discuss is glucocorticoids. Very importantly are cortisol. So see here friends, very important. 90 to 95% of cortisol is in bound form. Why in bound form, sir? What binds to this cortisol? So see here, this very important globulin, the name is CBG, cortisol binding globulin, also known as transcortin. This globulin binds to this cortisol. That's why 90 to 95% of cortisol is in bound form. Now very important, pharmacology. Because of this bound form, this cortisol have one very longer half-life, 60 to 90 minutes, right? The T half of aldosterone was just 20 minutes, but this cortisol having half-life of 60 to 90 minutes because 90 to 95% of cortisol is in bound form. So with this important note, so now we are going to see something very important, the functions of cortisol. So see here friends, very important. The most important function of cortisol is metabolism. What type of metabolism, sir? So the first one is protein metabolism. So in protein metabolism, our cortisol is having both catabolic and anabolic effects. So see here, the catabolic effect of cortisol is in the muscle proteins, causes proteolysis. That's why there is release of amino acid alanine. Now, in certain disease condition with the elevated levels of cortisol like Cushing syndrome. So in Cushing syndrome, due to increased cortisol, the patient will manifest with muscle weakness because of increased catabolic effect, right? Now, the anabolic effect of cortisol is in the liver. That's why it increases the plasma proteins. So because of both the catabolic and anabolic effect of cortisol in the metabolism, especially the protein metabolism, this effect of cortisol is known as dual effect. Now very important. So now after protein metabolism, the second metabolism is carbohydrate metabolism. So see here sir, very important. What is the effect of cortisol on carbohydrate metabolism? So our cortisol produces glucose by using the non-carbohydrate sources. What are those non-carbohydrate sources sir? See here, very important. These non-carbohydrate sources are alanine, the amino acid alanine. Remember the catabolic effect of cortisol on the muscle protein, right? So by using the non-carbohydrate sources, this cortisol produces glucose by the process of neoglucogenesis. Very important. Since now we know that by using non-carbohydrate sources, our cortisol produces glucose. That's why our cortisol causes hyperglycemia. So in pathological conditions with high levels of cortisol, our cortisol can develop diabetes mellitus. Since this diabetes mellitus lies in adrenal glands, so known as adrenal diabetes mellitus. Very, very important. Now after carbohydrate metabolism, the third one is lipid metabolism. So our cortisol enhances the lipolysis. That's why there is increase in free fatty acids. Very important. So with this important note, after metabolism, now we will see the other functions of cortisol. What are the other functions of cortisol, sir? So see here, very important. The first function is anti-inflammatory function. How, sir? Because of cortisol, it reduces the levels of prostaglandins, inflammatory mediators. Also, it reduces the levels of allergic substances like histamine. Not only this, sir, our cortisol also reduces the levels of phospholipase A2, another very important inflammatory mediator. And lastly, it reduces the levels of interleukins, IL-2, interleukin 2. So these all actions of cortisol required large doses of cortisol. Very important. Now see, the second action of cortisol is effect of cortisol on bones. So our cortisol also stimulates the osteoclast cells. These are the bone cutter cells. That's why lead to bone resorption, sir. Very important. That's why pathologically high levels of cortisol can lead to osteoporosis. Very important. With this important note, now see here, the third function of cortisol is effect of cortisol on blood cells. So see here, our cortisol decreases certain blood cells like eosinophils and lymphocytes. At the same time, it also increases certain blood cells like your RBC, red blood cells, and neutrophils. So your cortisol decreases eosinophils and lymphocytes, but at the same time, on the other hand, it also increases red blood cells, RBCs, and neutrophils. Now, very important. The fourth function of cortisol is effect of cortisol on GIT, or gastrointestinal system. So see here, sir, our cortisol increases the gastric acid secretions. That's why high levels of cortisol causes peptic ulcer. Very important. The high levels of cortisol can cause peptic ulcer because our cortisol increases the gastric acid secretions. Now the fifth function is effect of cortisol on reproductive system. So very important. Our cortisol is a negative regulator of reproductive functions. Why, sir? Because of cortisol, it decreases the gonadotropin releasing hormone GnRH. Very important. Now the last and very important, the sixth function of cortisol is permissive action. So here our cortisol no need to do anything. Only the presence of cortisol enhances the actions of other hormones. See here, the action of catecholamines is lipolysis and bronchodilation. So in the presence of cortisol, these actions of catecholamines will be more pronounced, right? So with this important note, so till the time we have discussed about the hormones produced by the first two layers of adrenal cortex. Now we will talk about the adrenal sex steroids, the hormones produced by the third layer of adrenal cortex, that is zona reticularis. So what are the sex steroids, sir? So these are DHEA, dihydroepi, androsterone and androstenedione. So these sex steroids are found in both males and females. Since DHEA and androstenedione, these are the male sex hormones. So why they found in females, sir? Because of one very specific function. What is that? Because these DHEA and androstenedione, these sex steroids, they regulate the sexual drive, that is our libido, in both males and females. Not only this one, it also regulate the growth of certain heads, the axillary and pubic hairs, right? So zona reticularis, they search for sex steroids, and the sex steroids are DHEA and androstenedione, found in both males and females, and the functions are it regulates the sexual drive, the libido, and the growth of axillary and pubic hairs. So with this important note, so thank you so much for listening, and please give your important feedback in the comment section. Stay safe, stay happy, have a great day. Thank you so much.